Bob Schrupp, physical therapist.
Heineck, physical therapist.
We are the most famous physical therapists on the internet.
In our opinion, of course.
Today we have for you 3 core exercises for back pain. You must know this if you have back pain, because this can help take it away.
Right, right. Bob, do we want to carry on with this, or want to bring people in right
Let's
away?
bring people in.
Sure.
If you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, if you got the chance, go over to Facebook and like us, because you like us, we like you. It's Bob and Brad.
There you go.
Thank you.
Bob, I've been doing a little research just to see what is out there for core exercises with back pain, and I think as therapists we're think a little different than trainers and people who are really good at getting
A lot of times when people
stronger.
say core exercises, they think core strengthening, but you can actually stretch the core too, and
Right.
you want to stretch it in the right manner
Right.
so as to take away the pain. So we're going to show you stretches and strengthening for
Right.
the core.
So one key thing is anytime you do an exercise for the back, if it creates pain, makes things worse, it's a red flag. Stop doing it. Don't think if I get my core strong enough and work through the pain, it's going to get better. It's not going to happen. You need to do what we call directional preference exercises. In other words, the direction that you're moving your back should make it feel better with repetition.
Right.
And oftentimes right away, and that may vary a little bit. So we're going to walk you through this.
So there's 3 directions we're going to be looking at.
Right.
So the first one is basically trunk flexion, and you can do this laying down. I'm not going to have you do it standing up.
Right.
And the way to do it laying down is you actually, in order to get my back to flex, I'm going to actually, you can start off with just bringing one knee to chest, but
Sure.
eventually you're going to have to bring both knees to chest.
Right.
And you're going to do repeated. So I'm going to do it the first time, it's like, oh, it hurts a little bit. But as I keep doing it, it actually feels better.
Right.
Then that's the stretch you're going to do. Now, if you have like sciatica, this is probably going to make it worse, more than likely.
Right.
Or herniated disc or a bulging disc. And what you're going to be looking for is the pain down the leg actually gets worse when you're doing this. Then you would not do this one. This
Right.
is the one you would not prefer.
Anything that makes the back pain, and when we say back pain, we're talking low back pain here, not up by the neck.
If you know your diagnosis, if you have stenosis or spondylolisthesis or arthritis, this one often will help.
Sure.
This one actually is going to feel better, and this is the exercise you'd be doing.
Right.
You do pressure on, pressure off, pressure on, pressure off. Again, you might start with one knee.
Right, and I'm going to suggest, go ahead and do it again, Bob, but if this does feel good, you're going to let go of the knees, and with good control, let your feet all the way down, both feet all the way down. There you go, to the start position.
Oh, what am I doing, Brad?
There you go. Now go ahead and do the exercise. There you go, and let him go down to the start position.
Okay.
That way you're getting some strength
Sure.
along with it.
Yeah, I wouldn't go all the way out like this.
No,
Brad. Yeah, okay.
no.
That's what was throwing me off. So yeah, you can start. Yeah, you're very correct, Brad, in saying this, because this doesn't take that much back strength to do so.
Right.
But it's very good for the core. So you get a
Sure.
little strengthening and stretching at the same time. So let me go to the other one, Brad. This is one that generally most people can do, and it is good for them, is doing trunk rotations.
Sure.
So, and I'm going to go in both directions, and I rarely do I find someone that can't do these. I don't know if I have found one
Sure.
that can't do these. And sometimes they have to start in a real limited range,
Yep, just back and forth a little bit.
and then they can work their way out further. And sometimes they find out that they hurt in one direction, but they don't hurt in the other direction. So we just have them do that direction. And I just had a lady yesterday. She hurt going to the left,
Yep.
but she could go to the right.
Sure.
And so I said, just work on going to the right then. I said, eventually you can retry it again to the left, but right now just stick with that.
And along with this, it's not an intense exercise, but there are core muscles that are exercising to do this. So we're working in the pain-free range of the directional preference, and we're getting some low
Yeah, you're
level
working your
strength.
obliques
Right.
to some extent.
Mhm.
So
Exactly.
now the one that I would say is going to help like 80% of people with
Sure.
back pain is actually back extensions.
Mhm.
So you're going to start off with, and again, if you're getting pain down your leg, you want to make sure this is actually feeling better.
Right.
The leg pain is actually getting better.
Here, should we
So,
get this out?
yeah, we're going to start off with, you're going to maybe just lay here for a bit and let your back settle in. And then you might even get up onto your elbows
Sure.
and see how that feels. Does that feel better? Does that feel worse? Does that feel tight? You know, and then eventually you're gonna work up to hands underneath the shoulders, and you're gonna start doing press-ups. And you wanna make sure the pelvis is not coming off the bed here
Right.
like this.
We're gonna get into some strengthening exercises that
Yeah.
way. So these are progressional exercises. We're showing the first set of exercises.
Which is, you know, basically the stretching, and the stretching, you wanna find out which one of the three that you wanna do. You might be able to do the rotation and these.
Right.
Or the rotation and the flexion, but, most people aren't doing both flexion and extension.
Yeah, in other words, this and the one where you're
Yeah.
bringing your knees to the chest, those don't mix together. Sometimes they do, but usually not.
And you can do these quite often, you can do these 5 times a day if you want a set of 10.
Right.
And even, maybe even a few more.
So, once you found the direction of preference that feels good in your back, whether it's extending backwards or bringing your knees to the chest, and that's feeling pretty good, then we can go to some more core strengthening, step it up a notch. Bob, can you?
Which ball do you want?
The red one.
Okay.
All right. So, if it happens that bringing your knees to your chest continually feels good, and that's getting too easy and you want to work more core, I like to use the ball, and I'm going to go like this because it supports the back, and hands here, and simply do exercises like this. And I'll do, 15, 20 of these.
And this is good for people with spondy and spinal
Stenosis, yep.
Wouldn't be good for a herniated disc probably.
Right. The big thing is if you haven't gone to the doctor, you have no idea what your diagnosis is, you're going to do what makes your back feel better. And that's the bottom line. Okay? Now, if you want to strengthen your back and you're doing the press-ups, and we want to work those extensor muscles, you can lay like this, and then we're going to work, this is working the core, but instead of the stomach, we're working the backside, which is just as much as your core is your stomach. And I think some people think core, they think stomach all the time, but it's not. We do want to work this as well. And how high you go up, you can put your hands here and help with your hands, and as you get stronger, you can take your hands off, go across like this.
Now the back is working a lot harder.
Right, and where you position yourself on the ball is a really nice feature of the ball, because you can make it harder if you're doing them here versus here. You're not working the muscles as much as all, which is a good place to start, and you progress going forward. The other thing to get, if you work in that rotation, here we can work opposite elbow to opposite knee, or right elbow to left knee, left elbow to right knee, and then we're getting some obliques and some of that rotational component.
Again, that's going to tend to be the person who likes flexion. That's the one that's going to probably like that one.
Right, exactly. Now,
If you're afraid of getting on the ball,
right, you don't want to get on the ball, or, if you don't have any pain and you want to work, and you like planks, because you don't want to, you think that you need that,
core strengthening.
right,
Yeah.
core strengthening without movement, which I'm perfectly comfortable with. I'm going to show you two options for planks. Simply you can just start here and hold it for 30 seconds, 2 minutes, whatever you can do to get that core exercise the way to your tolerance. If you want to do side ones like this. Now, I personally cannot do planks very well. I've tried them. They hurt my back. I got spondylolisthesis, so I never do them this direction because I know the next 2 or 3 days I get a very sore back. So I go to the vertical plank, which I tolerate much better. And by that, I mean you do have to have some resistance bands connected to the wall, or using our wall anchors. So I use, and right now I'm going to tighten my stomach, and I'm going to hold it like here. And right now my stomach is working as hard probably as when I'm doing the push-up plank, where I'm holding like here. And then you can get movement with this as well, and I like doing that also. If you want to work some of the rotational component, you can put it to one hand and work here, but still maintain that straight core plank.
So you're getting a double benefit here. You're getting some arm strengthening, some chest strengthening, plus you're getting the core strengthening.
Right, exactly. And you're working your balance as well, because you're upright. You can do these actually on one foot, and then you're working balance
People
along
are
with the
often
core.
very surprised a lot of times how much it works your balance.
Right, yep. This, if you haven't done it, you'll say, oh, it doesn't look too hard. But once you do it, my ankle's working quite a bit. And then you're doubling up things. You get core, strength, balance, and making a whole exercise routine real functional.
All right,
I'm getting
well,
tired, Bob.
good job, Brad. I appreciate everything you do. Thanks for watching.